Sebastian Coy is a happy and healthy 2-year-old. His mom, Andrea, cherishes moments like this at home after her son got really sick last year.
You're so high.
His oxygen levels were really low. And what we later found out through testing is that he had a couple different viruses, bronchiolitis and bacterial pneumonia.
Sebastian spent a couple of nights at the Poudre Valley Hospital in Fort Collins until doctors said he was getting worse and needed to go to Children's Hospital in Aurora.
Told us, he's not getting better. We can't provide the level of care that he needs here anymore. We're requesting his transport to Children's Hospital via air ambulance, and they were already on their way. They were about 5 minutes out at that point.
Andrea felt she had no choice. Take the helicopter ride or her son won't get better.
Do you want your son to continue breathing? That's not a choice.
Reach Area Medical Services charged a little under $65,000 for the 60-mile flight. Her insurance company covered $28,000, leaving her a balance of more than $36,000.
This is one of the most egregious examples here of the system simply not working.
Lauren Adler studies health policy at the University of Southern California. He believes it's significant for the company to get paid nearly $30,000 already for the flight.
Whereas Medicare would have paid about $7,000. And even if this was an air ambulance, another private sector air ambulance not owned by private equity, they probably would have gotten paid about $20,000.
A spokesperson for Reach Area Medical Services says they won't take legal recourse against the family for not paying. Andrea says that doesn't really make her feel any better when all she was focused on was bringing Sebastian home.
Why do they get to take advantage of people in their darkest moment, in their biggest moment of need?
Now, there was a federal law that took effect this year that creates new protections against surprise medical bills, including from air ambulance companies. It should appear to the patient as if the ride is in-network. Andrea and her family are not covered under these protections, though, because this flight occurred last year. Alex.
This is incredible. Hard to even wrap your mind around being in that situation and having to make that split-minute decision.
Yeah, and they really didn't even feel that they had a decision, right? The doctors just come in and say, we cannot provide the care that your son needs. The hospital is on, or the helicopter is on its way, and your son is going to get on it. So she just felt like she wasn't able to make a decision here.
Yeah, no decision indeed. Kelly, thank you for covering this.